All right, everyone. Welcome back to week 2 of what we have our 7-week program with United Healthcare and understanding the basics of Medicare. I believe today's topic is the value proposition of United Healthcare. So I'm going to go ahead and hand the floor over to Matthew and let him get started, but excited for another week. You guys get ready. Let's do it. Here you go, Matthew. Floor is yours.
Awesome. Thanks, Jeff, and welcome back, everybody. It's nice to see the participant list with some familiar names. So I'm glad we didn't scare you off last week. So we're excited to continue on our training here. And this week, we're going to be hearing from our entire Northern California sales team. So Kent Lewis, Brett Johnson, Carlos Campos, and Raheel. So we'll get started here and go over our agenda for today. So what we want to do is just review a little bit on Medicare 101 again. I'm going to give you guys a little pop quiz. And then we're actually going to change things up a little bit more. We've talked about United Healthcare and the value proposition, and that will continue on as a conversation throughout our entire training session. So we're going to dive into our products a little bit more. I know we touched on our Medicare Advantage and our Medicare Supplement lines of business. So we'll dive deeper into that section. And again, we'll go over the contracting process for those that aren't currently contracted. We did see some names come through this week and hope to see some more. So again, a familiar slide that you guys see today. We talked about Medicare 101 last week. This week, we're going to hit on our product overview. As you see, we have our election periods after that, and then our selling compliantly section, which we'll talk a little bit more about in a few weeks. And then we'll start applying what we've been teaching and getting you guys comfortable with our enrollment tool and the different scenarios that you might encounter when working with clients. So moving forward, again, another familiar slide. Just want to hit this home. We're going to continue to talk about the contracting process. Work with your uplines or your leaders on getting that contracting email, or if you are working on getting that health insurance designation to get that started today. And then as you submit paperwork, we'll get that party ID issued. That will give you the ability to take your certifications. And again, certifications will be done through our platforms here once you get your party ID. After you complete certifications, then you'll get your golden ticket, which is that writing ID, which is the end goal in all of this. So that will get you to be able to sell. So a few steps there. If you have any questions, feel free to reach out to one of us. Again, Jeff has gone through this process already, so work with him or any of his leaders to get you guys up and running. All right, so pop quiz 10, Medicare 101 review. So I have a few questions, 3 questions, and I want you to use the chat. So find your chat box. We want to see where you guys are at with what we reviewed last week and get a gauge on if we need to review more or if we can move forward. So first question, what are the 4 parts of Medicare and what do they cover? So use the chat, put your answers in the chat now. What are the 4 parts of Medicare and what do they cover? And I'll give you the first one. Awesome.
Looks like Wendy beat you to it there.
Yep. Part A, hospital.
I think some of them are
There's
trying
3
to
other parts. Let's see.
last week.
Yeah.
Looks
Part
like
B,
Michael
doctor.
got
Nice job, Michael. Yep.
and Wendy.
Delia. Medical expenses. You're right. Part B. How about the other 2? So you have Part A and Part B. What are the other 2?
There's one of them.
All right, Melanie, Part C. Nice, Jack. A, B, C, D, hospital, medical, Medicare Advantage, and prescription. Good. Awesome. So let me go. Let's show the answers real quick. A, B, C, D, hospital, doctor and outpatient, Medicare Advantage, which we'll dive into deeper today, Part C, and then Part D as well. We'll talk a little bit about prescription drug coverage, standalone prescription drug coverage. So good, nice job, guys. All right, question number 2. So after you enroll in Original Medicare, what are your 2 options for additional coverage? So you have Original Medicare, and then clients have the ability to get additional coverage. What are those options?
Leah answered it correctly.
Awesome, seeing some good answers come through here. So yeah, it's our Medicare Advantage plan, and then the other option that you have is our Medicare supplement, and you can add, or you don't have to add on prescription drug coverage, but it's certainly advised to get that coverage so we don't have that late enrollment penalty. Okay. All right, so last question of our pop quiz here. So what is one advantage of a Medicare Advantage plan, and what is also unique about a Medicare supplement plan? So these answers can vary, but what do you remember about a Medicare Advantage plan and a Medicare supplement plan, and kind of how they differ? So there's some different answers that you can have. Nice, Rick. Yeah, Medicare Advantage, pay as you go. Medicare Advantage all in one. Nice, Jack. Supplement, you can enroll year round. Yeah. Awesome. So yeah, in simple terms, and again, there's many answers to this question, but our Medicare Advantage plans, they have that bundled coverage, and then they can offer some additional benefits that Medicare doesn't cover, such as vision, dental, hearing, maybe it's a gym membership, and we'll talk more about that today. Then Medicare supplements, you have that flexibility and choice of who you can go to and who you can see. So we'll talk more about the advantages of both options, and hopefully by the end of today's presentation, you'll have a little bit more clarity on our detailed plans of our Medicare Advantage and MedSup. All right. Well, good. Thank you guys for your participation, and you guys all passed. So we'll move on to the next section here. And I'm going to pass it over to Kent Lewis, and he is going to begin our plan overview. And you'll hear from all of our leaders in Northern California today on our different plan offerings. So Kent, take it away.
Awesome. Thanks, Matt. Thanks everybody for being here. And I like the answers and the chat, and just to keep that discussion going, because yeah, you're learning, like learning a new language, right? You're learning this Medicare and really becoming an expert. That's the goal here. So as we start to look in the different options, I want to cover a couple quick things before we even go to the next slide. And first is the Medicare Advantage plans. When you look at that versus Medicare Supplement, we like to say there's no perfect plan for anybody. Everybody has different needs, and you'll find that as you go and you're doing your needs analysis. But a couple differences are Medicare Advantage plans are filed by county or region, where they can have several counties. So for example, San Francisco, we have plans that are filed just for San Francisco. San Mateo County, we have Santa Clara County. Sometimes we have one plan in multiple counties, but typically it's by county or region versus the Medicare Supplement. The Medicare Supplement plans, those are filed by the whole state. And the only difference is the Medicare Supplement, you'll see, is it's a different rating scale. So it's based on, you know, if you're coming in at 80 years old, you're going to pay a higher rate than somebody who's 65, versus the Medicare Advantage, where it's filed for the county and everybody's going to pay the same rate. Even if somebody who got Medicare at age 30 because of a disability, they buy a Medicare, or they get onto a Medicare Advantage plan, they're going to pay the same rate for that as somebody who's 70. So just a couple quick differences there. And then as you start to think about going to the next level with your outreach and reaching out to your clients and networking and those kind of things, as you get the lingo going, everybody refers to their plan as a Medicare supplement. So you're going, yeah, well, what kind of Medicare plan? You know, the person has Medicare, and you're telling them that you're getting into Medicare now, and they'll say, oh, well, great, I have a Medicare supplement plan. Don't be confused there, because everybody, including some doctors and hospitals, they'll go, they just assume anything above Medicare, it's going to be a supplement in their mind. So you got to ask a few more questions about, you know, what's the carrier? Is it employer group plan? You know, do you have a prescription drug plan included? And then you'll start to drill down and you'll become an expert there. But that throws people off track right away when you're first getting into Medicare there. And then as you start to come up with your approach there's 3 questions everybody's going to want to know. They go, how much is it? Is my doctor covered? And are my prescriptions covered? Those are the top 3 things you'll live in. You'll understand how to look at prescriptions and look up the doctors and all those things. And then one of the questions there is, how much is the premium? And when you see the premium differences between a Medicare supplement and a Medicare Advantage plan, much lower on the Medicare Advantage plan typically, that becomes a hurdle that you'll have to go over. They'll say, well, geez, it's $39 a month in San Francisco. You know, maybe they're coming off a group plan where they know the employer was paying probably $2,000 towards that cost at age 64. They were maybe paying $300-400 out of pocket for their share cost. And they're going, how come it's $39? And so the way that works, I just want to take a quick second to let you know how Medicare Advantage plans are funded. So Medicare takes what they know is the average cost that they will incur for claims for someone who is on original Medicare. You know, that's your Part A and Part B of Medicare. They take that average cost, and if somebody goes on to Medicare Advantage plan, Medicare will pay the insurance carrier that cost. The insurance carrier then, if they pay, and then it's up to them. It's like, okay, it's all in your court now, United Healthcare. If we pay out more, then it's out of our pocket. If we pay out less, then we get to actually have a profit there. So that's how that works. And so it's helpful to have that in the back of your mind, because believe it or not, you'll have that question come up quite a bit as you start to have those conversations with people there. And then lastly, before we go to the next slide, just want to say that as we were starting off 3 weeks ago, we mentioned a couple things. And one of the key metrics we're seeing is 40% of Medicare eligibles in the past 5 years are choosing a Medicare Advantage plan over the other options, the Medicare supplement in the market. And we'll go through some of those differences. So Matt, if you want to go to the next slide, I'll tell you a couple of differences there. And really the question is why are people choosing the Medicare Advantage? Or what I like to say is, what are the advantages of a Medicare Advantage plans? And here's how it is. You got your lower monthly premiums. That's a no-brainer. Okay, great. You got a bundled plan. We've talked about that a little bit. Hospital, doctor, prescriptions, all in one. But there's a lot of extra coverage included with that. You know, all the ancillary benefits that you have. A lot of plans have the fitness membership, dental, vision, hearing, a whole bunch of different options that are included with their Medicare Advantage plan that's built into that. The other thing that I wanted to mention, just take a quick second on the worldwide emergency coverage. And this is an area that, you know, if you have some experience in Medicare in the past or been around that, there was a thing, oh, okay, well, if you're traveling all the time, then you got to go to Med Sup. That might be the case for some folks, but when you look at the worldwide emergency benefit, a Medicare supplement, let's say you pick up a Plan F or Plan G. I know you talked about Plan G last week. That has a $50,000 lifetime benefit for worldwide emergency coverage out of the country. Medicare does not cover you, does not cover your insured out of the country at all. So on a Medicare supplement, you pick up typically one of the better plans, you're going to get that $50,000 for worldwide emergency coverage. But here's the thing, it's a lifetime cap. When you compare the benefit on our Medicare Advantage plans, and this is a distinct difference with United Healthcare versus other Medicare Advantage plans in the market, we do not have a limit. So we've had some great stories of people that have had, life-threatening situations. It has to be emergency, but, person in Costa Rica or the Dominican Republic had a major, we assume heart attack. They wouldn't give us the condition, but a whole bunch of things happen. It incurs, $40,000 or $50,000 right off the bat. You're not having to worry about hitting these kind of limits. Take that same example and you go to Germany or you're somewhere else where the healthcare costs can be $100,000, $200,000 for those types of services, emergency life-saving things. That no limit can become a big deal there. So when you compare that to some of the other ones in the market, you'll see a $7,500 worldwide emergency limit. You'll also see some companies that will have 15,000 or even 100,000, which is just not the greatest compared to our benefit there. And then another couple of things here is the 3-day rule. As you get into Medicare and you start to learn this, Medicare requires for skilled nursing facility benefits to kick in, a person has to be hospitalized for 3 days. So if you're on a Medicare supplement, the supplement plan is doing everything that Medicare is covering. It's going to supplement that. But they require, so that means if you haven't had the 2 days in the hospital, the skilled nursing care is not going to be covered. And we've actually seen people having to pay out of pocket because a lot of things these days are taken care of in a couple of days and you're done without having to be in the hospital for 4 or 5 days, where you're in 2 days and into skilled nursing care directly. So we don't have that rule with the Medicare Advantage plan. So a couple key things as you're starting to formulate your overall awareness of product and putting people into categories and what plans would work, just keep that in the back of your mind. And then, of course, we have the overall coordinated care approach to healthcare. I like to say the quarterback approach, where you're having your one doctor who knows the prescriptions you're taking, they know the specialist you're going to, and they have an overall idea, and they're incentivized to have you come in each year for your annual physical. And you're looking at, okay, well, how are you doing? What are you doing to improve your health? Maybe you're trying to lose weight, or maybe the person's trying to quit smoking. And all that to say, the results are 31% fewer hospital stays. And by the way, that's also about 20% less on the hospital readmissions. So when you look at that and you say, okay, well, people are just getting, kicked out. Not the case. We actually see a separate one, which is not on the screen here, that hospital readmissions for the same conditions are significantly less as well. And then shorter hospital stays overall, because there's this overall approach to the patient care there. So just wanted to mention that as you're formulating everything and we go forward here. So next slide, we'll look at the HMO. So I'm going to cover the section for HMO coverage. And really, this is going to look at, this is what our key, most of our Medicare Advantage plans are HMO plans. But we have HMO, on that first slide you saw HMO, PPO. We also have your Medicare supplement prescription drug plans. But the key things you're comparing is a Medicare Advantage HMO, perhaps a PPO, to a Medicare supplement. So this section we're going to get into a little bit is an HMO. What is it? Health maintenance organization. Most of us are familiar with that from being maybe in the individual market or on group plans. We understand how that works. The network-based type of care, where you are needing to go to that one set of physicians, unless it's an emergency, then you can go out of the network there. So that's the basic standards on an HMO. Who would like it? Those that don't mind using a network, that maybe are using UCSF doctors with Hill Physicians, or Sutter, or John Muir in the East Bay, or PAMP, Palo Alto Medical Foundation, all these different ones that are part of our Medicare Advantage plans. It's like, oh, perfect. Oh, you use Dr. Smith with UCSF in San Francisco? Great. Well, they're part of Hill Physicians. That doctor is going to be part of our Canopy plan. So those types of things. So those customers, some people will say, well, I want to be able to go on a plan that, I go to any doctor I want to. Well, that's good. And you go, well, maybe a Medicare supplement would be a better route to go. But you drill down a little bit further, you find out their doctors with that, the coverage differences and what they're looking for actually might be still better off on a Medicare Advantage, or maybe the Medicare supplement is the way to go. So when you look at that, people in this bottom one is who should avoid it. So let's say you have doctors. Well, I have a doctor that's part of UCSF, and I see them for this. I also have a doctor that's part of Stanford, and then I go to this doctor over here that's part of Sutter, and I have all of these different doctors, and throughout the Bay Area. That is a person that's probably going to be better served with the Medicare supplement plan, just because there's so many differences there. On top of it, they mentioned, oh, I also go out to New York and spend 3 months of the year out there with my, with my grandkids. And, I need to have that flexibility to choose that doctor. That person is starting to go, okay, Medicare supplement probably better than a network-based HMO type of plan there. And obviously, how does it work? You're going to in-network providers. If sometimes we do have our networks will refer out of the network. I know, for example, Meritage in the North Bay over in Marin County, they have an agreement to refer to UCSF for patients that maybe need that extra care from UCSF. So they have the ability to refer out of network, but it's got to be approved first. And most of the times, if they just choose to go to the doctor, well, I'm going to Stanford, it doesn't matter, I don't care. Well, in an HMO environment, you're probably going to pay out of pocket for that. All right, so next screen. So the next screen, we're going to take a look at a couple of comparisons. And I wanted to show you this in really some of these slides so you can start to get an idea of the plans and how it works. This information is available in every enrollment kit. So when you're looking and pulling plans for San Mateo County, or maybe you're in LA or wherever you're at, it's going to be all basically the same. And so what we see here is the plans for San Francisco. And this we have on the left is our Canopy Health plan. On the right is our Secure Horizons HMO plan, which, by the way, that is with Brown and Tolan is the network of doctors that we have there. So all of these Medicare Advantage plans, you're going to see it's going to talk, okay, what's the premium, right? $39 a month, $54. And this is actually, this is a presentation. We talked about having tools that are ready to go for you. A lot of you like to do these community presentations, already doing Social Security type of presentations and those kind of things. This is actually something that's available for you. So you can go through and start to present the benefits, and it's right there for you. So you got your PowerPoint, you're ready to go. No annual medical deductible. Nice to have that. So once they start to have, maybe they need to have some lab work and those kind of things. It's no deductible to worry about. And then you get into the primary care provider visits. These plans have 0 copays. You're going to see some that have 0, 5, 10, 15, depending on what area you're in. Then you get into specialist, of course. You pay a little bit out of pocket in this plan, $10 for specialist. And then it says, okay, is a specialist referral required? That's important because on an HMO plan, you do have to get that. Whereas a PPO option within the Medicare Advantage plan, like we have in the North Bay counties, that doesn't require that. So you have a little more flexibility on choosing there. So every plan is a little bit different, but the overall format of what you're looking at is going to have the same information. And then you have hospitalization. That's one of the key things that people want to know, right? How much am I going to have to pay if I'm hospitalized? Kind of nice with a hospital, you're looking at a $250 copay. So if they're in the hospital for 2 nights, it costs them $500. Over on the other plan here, we're looking at $600. It's still pretty minor compared to what the hospital bill is and what it would be if you had original Medicare where you're having to pay that Part A deductible. And then skilled nursing care gets into the differences there. So those are the key things. And then outpatient surgery is another one that people want to know, well, what is it going to cost? Well, the maximum for an outpatient surgery, maybe you had orthoscopic knee surgery. You're looking at $195 copay. So pretty straightforward there. And let's go to the next slide. And that'll show us the differences on the extra benefits here. So, this goes more into ambulance is another one, x-rays, copays, and those kind of things. So one note on ambulance is you see here $250 copay for an ambulance. That's whether it's air or ground. Now that's important for people that, when you look at traveling, going to Tahoe, we see people that'll get sometimes care flighted out of Interstate 80 for a major accident and those kind of things. they're still going to pay a $250 copay, and that's it there. Emergency care, $90 copay. If you're admitted in the hospital, then you're looking at a $90 copay. If you're not admitted to the hospital and you go to the ER, that's going to be all you're going to pay there. Now, if you're admitted to the hospital, then you're within the 24 hours, that goes away. And that actually out of the country is a little bit less there. Here's another benefit that you'll want to key on, and that's urgent care, because they say, well, what if I'm down in Southern California and I need to go, I get a cold and I need some kind of a antibiotic or something like that. What does that look like? And this shows you, okay, great. Well, there are contracted and non-contracted, and you're going to pay a $40 copay, and that's straight across the board. So pretty nice to have that. Again, that's going to be worldwide as well, urgent care and emergencies, because people will have a tendency to think, well, I don't want to network because I'm going to be limited to just those providers. That's true for your planned care, your normal things that we go to the doctor for, a sore knee and this kind of thing, and whatever you have. But urgent care, emergency, you still have access out of the network there, or out of the area, I should say, and out of the network. Then when you look at the out-of-pocket maximum, this is going to be, you take all the copays a person paid. Maybe they paid a $15 copay for outpatient x-rays, or maybe they paid a copay for the ambulance or hospitalization, those kind of things. The maximum out-of-pocket is going to be $3,500 on this plan, or $4,000. The nice thing is with that, when you factor and look at, like, that keeps them from having to pay 20%. You look at original Medicare for physician services on Part B, that's 20% unlimited. So this caps them out. That's the most they would have to pay. Most of our insureds, about 1 out of 12, I should say about 11 out of 12 don't hit their out-of-pocket maximum, and that other person will. So pretty low that a person hits that out-of-pocket maximum. And then go to the next page. Now this is going to be important, because when you get into the extra benefits and features, and this is really where Medicare Advantage shines, what are the additional services that are covered above and beyond what Medicare typically doesn't cover? You got routine vision care, you got hearing coverage, the insulin savings program where it's a $35 copay or less across the board regardless. Over-the-counter benefits, that's cash in their pocket, where it's up to $160 per year, $40 per quarter for over-the-counter products like aspirin and vitamins and ACE bandages and whatever you have there. Memberships for gym and virtual. We have virtual medical that's included in all of our plans at a zero copay, and that's great, especially during COVID, right? It's like, hey, you don't have to go to the doctor in person. You just pay a zero. You can do it right here, and it's a $0 copay right through your phone or your computer. So those are nice to have, and you can go through. We'll have more benefits and explanations as we go through in the future on that. So then the next page. This is where you'll get it. There's one other page that I want to talk about. Maybe I skipped over it before I turn it over to Raheel, and that is on the prescription drugs. The prescription drug benefit summaries will show what the prescription drug deductible is, what the copays are for each of the different levels on the prescriptions. And so you'll key on that to show them how that works there. So the main idea, again, is it's standardized from plan to plan. So when you're looking at one county to the next, you'll get familiar with that, and it'll really become familiar to you. So you're not going to, you'll know exactly where to go. Benefit highlights out of the enrollment kit, all that information is available right at your fingertips. So that is a summary of how the HMO plan works. And then now I'm going to kick it over to Raheel Panjwani, who is going to talk to us about the preferred provider PPO plan. So take it away, Raheel.
Hey, thanks, Kent. Really excited to talk a little bit today about the PPO. Now, the PPO is one of my favorite types of plans to discuss, given that much of California has not seen a PPO until recently. The PPO is one of those types of plan that many cannot differentiate from a supplement plan. As Kent had highlighted earlier, there are so many different types of Medicare Advantage plans, but the Medicare Advantage plan that is a PPO is oftentimes conflated with a supplement just because of the wide array of benefits that it does offer, even with the people that even have them sometimes. These plans offer immense flexibility and are a huge selling point for people who want the peace of mind for the choice of provider that they see. If you take one thing from today, just remember a PPO is additional choice and the HMO is generally provider specific. Now, that does not mean that with an HMO, you don't have a wide array of doctors in the network, because you do. The HMO plan is actually the plan that I have myself, and I have immense flexibility in the doctor that I choose. But for those people that may have 5 doctors in network and 1 very important doctor out of network, or a specialist out of network, the PPO might be something that gives them that peace of mind. Additionally, the PPO can have huge upside for those people who may want to have a hospital covered that is out of network, for those situations that are not necessarily emergencies, but that they feel may arise in a non-traditional situation. I call this kind of the insurance effect, when what that basically means is that it is excellent for people that want to feel the comfort and omnipresence of having insurance in the in case or what if situations. An HMO, of course, will cover emergencies, but the PPO, again, gives them the flexibility in many other situations as well. I'm going to talk a little bit about what the PPO is in my next slide here. So, could you, the previous slide, please? Perfect. All right. So what is a PPO? A PPO is a preferred provider organization plan that offers a PPO network where all covered services are available in and out of network for a defined set of counties within a state. Now, remember, a PPO does offer access to doctors that are Medicare approved and are willing to accept the plan, but this does not necessarily mean that every single doctor is going to be covered. And that's an important distinction to make. Many doctors will be covered, but again, we want to make sure that they are Medicare approved doctors and that they are willing to accept the plan. Who are the people that would be really interested in this sort of plan? Now, these are going to be, again, those consumers who want the flexibility to go to out-of-network doctors, specialists, and hospitals, but it may cost more. Now, this does not always mean that it does cost more. For many ancillary benefits, it's actually going to be the same, right? Like if you have your Renew active membership, it's not likely that it's going to cost more. But that's where it's very important to look into those benefits and find out what those intricate details are. It works in a very simple way. Members generally pay less if they use in-network doctors, hospitals, and other healthcare providers. The member generally pays a higher cost share to use out-of-network providers. Again, there are some benefits that may be exactly the same and could be huge selling points for you. And it also may be extremely helpful to the member, because in some counties, in some areas, there may be benefits that are exactly the same, and those may be the benefits that matter the most to them. Who should avoid it? Now, these are the consumers who only use in-network providers like myself and hospitals and don't care about out-of-network access. Those are the people that may be interested in seeing if an HMO plan has better benefits and or a lower premium. A personal example of myself, I don't have many specialists, right? So I want to make sure that I'm seeing one specific doctor, and I'm seeing that doctor twice a year. And to me, the dental and seeing that one primary care provider is the vast majority of my health needs at my time. So for me, an HMO may be great. So just keep in mind, the member and the prospective member that you're talking to may have immensely different needs. And the PPO is one of those situations where you want to look at the people that really want a wide array of doctor availability. Some PPOs have different benefits that may or may not be more expensive than a local HMO counterpart. Oftentimes, the out-of-network rate is higher while the in-network rate is similar. It is always important to know the PPO and HMO in your area to understand the intricate differences. And now I'm going to speak to a little bit how the PPO may actually look. So for the Marin and Solano County PPO, it's going to be very similar to the HMO, but it does have the option for out-of-network coverage. Out-of-network services usually at a higher cost than in-network again. Traditionally, the PPO is what people think a supplement is, as I mentioned before, and don't realize that a Medicare Advantage like this is available. The PPO is the plan that many may want but don't realize is possible. One of the huge perks of a PPO is oftentimes a referral is not required. I repeat, a referral is not required. Now, when you talk to a lot of members, they're not going to associate this with the Medicare Advantage, because a lot of times by word of mouth or information that is spread, they may feel that a Medicare Advantage is synonymous with an HMO. They may feel that a Medicare Advantage is the type of plan that is restrictive, or it is not allowing for out-of-network doctors or even emergency situations. I do want to emphasize that both the HMO and the PPO do cover emergency situations. However, with the PPO, oftentimes a referral is not required. A PPO is perfect for somebody who may want that immense doctor flexibility, even insofar as not having a referral. For somebody who's looking for doctors that are approved by Medicare who are willing to accept a plan, this is a great option. If you look at the above map, you can see that the costs are only slightly higher, but they're still covered. In most HMOs, they would not be, depending on the part of the country. Now, there are other plans that we won't go into called HMO POSs that do cover additional benefits. But as far as the PPOs go, they usually replicate the in-network benefits out of network, just at a slightly varied cost. So as you can see, for something like an outpatient hospital, including surgery, you're looking at $0 to $250 copay on the left side of your screen. Whereas with the out-of-network, you're still seeing the zero. You just have a $250 variation on the out-of-network side between $250 and $500. For somebody that may not feel that that is a huge disadvantage, which in my opinion, it is a great opportunity, not a disadvantage, that might be a huge selling point for them. So as you can see, the variation in cost is not always substantial, and it could actually be completely minimal or non-existent. And finally, sometimes the out-of-network doctor may be something that is a selling point, so be sure which needs and pain points are most important to the prospective member. It may be something as small as one doctor that carries 95% of the weight that the consumer is willing to enroll in the plan for. So if you have a prospective member where an HMO seems excellent, but one specific specialist is out of network, a PPO is definitely something to consider. And you know what? That cues over the PPO. I'm going to turn it over to the East Bay and Santa Clara County Market Manager, Brett Johnson, for the Assure plan.
All right, thank you, and welcome everyone. Thanks again for having us. Before I get started in going over the Medicare Advantage Assure plan, I just want to point out a couple things. As an agent, life insurance agent, this may appear to be overwhelming. If I could just break this down, it's almost as simple as writing an IUL policy. Yes, it has a bunch of moving parts, but once you understand what those moving parts are, similar to what Matt introduced in the beginning, part A, B, C, and D, it comes together very, very simplistic. These are simply the details of each of the plans. But again, the plans are amongst themselves are very, very, very simple. I was a life agent as well, did annuities, the whole 9 yards there. I found this far more easier. Again, putting together a Medicare Advantage plan is far more easier than completing an annuity policy. So just, to make sure everybody is a little more comfortable with it, it is not that complicated. And again, you have a team here in Northern California that's going to help get you all up to speed on how this actually works and how it can be an added value to your existing book of business. Okay, Matt, let's go. Next slide. Let's get started. Talk a little bit about the Assure plans. I'm going to kind of be brief here because I want to leave some time at the end. Carlos will be coming behind me, touching a little bit on Medicare supplement plans and the prescription drug plans. But what I'd like to hear some of your questions on how these things work. So what is an Assure plan? Just like Kent just reviewed, it is a HMO plan. So it's a network-based HMO plan, similar to the plans that he covered, like the Canopy plan and the Secure Horizons. This plan, however, the Assure, is unique in that it's targeted toward those who are full dual eligible, right? The full dual eligible Medicaid population. And what that means is, as Kent was mentioning, your original Medicare is your Part A and your Part B. Then from there, you go on to get your Medicare supplement, or you go into Part C and get a Medicare Advantage. Remember those two options that Matt mentioned in the beginning of his quiz. The Assure plan is no different. It is a Medicare Advantage plan, but it's targeted for those with both Medicare, original Medicare, and also Medicaid, which is Medi-Cal. The California version of Medicaid is called Medi-Cal. So again, that's not that complicated to understand once you start doing these deals, but again, that's what the Assure plan is designed for, those who are dual eligible. How it works just like a Medicare Advantage plan, and those who should avoid it are those who are not full Medicaid eligible, who do not have full medical eligibility should avoid this plan because it could be very expensive. And again, your team, including myself here in the East Bay, will help guide you through that and help you determine and identify those who are full eligible through some of the tools we use. Next slide. So I'm not going to go through the plan in totality, but it's similar to the side-by-side that Kent shared when he shared another one of our Medicare Advantage plans. But what it's important to point out here is if you are not full Medicaid eligible, as you can see on the right-hand side, the plan premium is a cost, as well as you have shared cost, co-insurance for your primary visits, co-insurance for specialist visits, so on and so forth. But here's the beauty. If you are full dual eligible, meaning have original Medicare Part A and B, as well as Medicaid, Medi-Cal, you can enjoy all of the benefits free of charge. As you can see, 0 plan premium, 0 specialists, 0 inpatient hospital care, skilled nursing facilities, diabetic monitoring, home health care, and more. Next slide. Additional benefits offered through the Assure plan include routine vision, some hearing, and most importantly, some of those ancillary benefits that are not offered in your regular Medicare Advantage plan, like those Kent shared. One of the benefits would be the over-the-counter, which is very popular. And basically what this is, it allows a member who has this plan to receive about $400 per year. It's given to them in a quarterly basis, so $100 every 3 months, where they can order over-the-counter items through a catalog. And what are over-the-counter items? Over-the-counter items are things such as vitamins, toiletries, shower handles, and more. It's a catalog of about 64 to 65 pages. So our Assure, Medi, or dual eligible members really love this plan. Most of them like it because of these last 4 or 5 things: the over-the-counter, the free gym membership, of course, the virtual visits, and last but not least, routine transportation. These are the things that are being offered through these plans that our members like the most, and this is what attracts them to the Assure plan. And again, we as a Northern California team will certainly walk you through all this. You'll learn this by the back of your hands within a month or so, guarantee it. I'm going to kick it over to Carlos. Carlos is going to touch a little bit on the med subs, and then Matt will wrap it up, and hopefully we can get some questions. Thank you.
Great. Thanks, Brett. Hopefully you can hear me okay here. And I just want to echo what Brett said earlier, how this is a lot of information and your head's probably spinning a little bit, but don't worry. This is the details thrown in there also. There's a lot of different plans, a lot of different programs. You don't need to know everything all at once. In fact, if I sat down with you for about 15 minutes and walked through the basics of Medicare, in that 15-minute time frame, you could probably go out and run 80 to 90% of the appointments and answer all the questions at those appointments just from that 15 minutes of training. Okay, so we're giving you a lot of information here. All you need to do is don't worry about the premiums, don't worry about the copays. You just got to know where to find it. Okay, and we'll get to that in a bit. So let's talk about the standalone prescription drug plans, Part D. What is it? Well, Medicare Part D is run by private insurance companies selling drug coverage. Okay, and the people who need this and who would like it, if you're enrolled in a original Medicare with a supplement plan, because supplements do not have drug plans attached to them, or if you're in an MA plan with only Medicare Advantage, no prescription drug plan, you're going to need a prescription drug plan also. Okay, and it's the way that Medicare provides prescription drug coverage. Okay, for pharmacies, and also you can do mail service. That's how it gets to them. The people who should avoid this are if you are enrolled in a Medicare Advantage plan with prescription drug coverage. And just to let you know, in California, I want to say like 95% of the Medicare Advantage plans have prescription drug plans attached to them. So if you do have one attached to it, you don't have to worry about the prescription drug plan. Okay, so next slide. Okay, so we have several different prescription drug plans, and I'm not going to get into details of these copays. Like I mentioned before, as long as you know where to find the material on our portal, you'll be able to find all the details. But we run about 3 different plans here, and the monthly premium varies quite a bit. So here's the high one at $99.30. And what you really need to know is by the higher the premium, the more the robust formulary, the more prescription drugs are in it at lower cost. Okay, so if you encounter somebody who takes a lot of medications or maybe a lot of expensive medications, this might be the better choice for them. Next slide. Okay, and so we have other ones also at cheaper amounts. So if you have run into somebody who does not take a lot of prescription medications, maybe doesn't take any, then they may want a cheaper prescription drug plan, which is only going to run them about $20 to $35 per month as far as premium goes. Okay, so that's the way the prescription drug plans work. Now, Medicare Supplement is a whole different creature. Okay, a lot of people, including doctors, confuse Medicare Supplements and Medicare Advantage plans. They are 2 completely separate things. Okay, you've heard about Medicare Advantage plans. The way Medicare Supplement works is you have Medicare A and B, and that's your primary insurance. Medicare is only designed to pay up to about 80% of your healthcare costs. Okay, about 80%, which leaves the consumer on the hook for the other 20%. Okay, and if you've ever been to an emergency room or had an overnight stay at the hospital or had an outpatient surgery procedure done, you know that 20% could be in the tens of $1,000s range. Okay, so to offset that 20%, you have a couple choices: Advantage plans or supplement plans. Okay, the people who would like a supplement plan are folks who maybe have a high net worth and just want to pay a one-time fee for the premium and not worry about copays as they go later on. Okay, that might be something. Or someone else who has chronic conditions, who's in and out of the hospital quite a bit, goes to see multiple specialists. The likelihood of them getting admitted to the hospital is high. Sometime that year. Those folks are somebody else who would probably benefit from a Medicare Supplement plan. And like Kent mentioned earlier, everyone is different. You can walk into a home and enroll the husband on a supplement plan and the wife on an Advantage plan. It all depends on their individual needs. Okay. Anybody who should avoid it, people who are on Medi-Cal should avoid it generally. Now, with supplement plans, you're going to have a higher premium and you're going to need to buy a prescription drug plan. So we're talking about $150 to $200 to $250 per month for these type of plans. Okay, so like I mentioned before, high premium, low copays. Okay, where the Advantage plans reverse, low premium and manageable copays. As you go, pay as you go. Okay, next slide. Okay, this chart runs the different types of Medicare supplement plans that are out there in the marketplace. Okay, now it's a lot of information. Don't worry, you can either screenshot it, but honestly, you just need to know where to find this information because all insurance carriers are the same. So every insurance company, us and everybody else out there, if we have a Plan G, then all the Plan G benefits are the same. If we have a Plan N, all the Plan N benefits are the same. There's little extra, tidbits that the different insurance carriers can throw in there, and their prices will be different, but the main bulk of the benefits are all the same. And you know what? You can Google this information from your computer. Okay, this kind of chart, if you just Google Medicare supplement chart and click on images, you'll find like 50 images of this same chart you see in front of you. Okay, so that's where you're going to have to go to find out what's the information. So when you're seeing a consumer, let's back it up a little bit. When you talk to somebody for the first time and you kind of get the needs analysis, get to know them a little bit, first thing you're going to do is educate them on Medicare, A and B, and then their choices. Medicare Advantage plans, here's how they work. Medicare supplement plans, here's how they work. The questions they ask you is kind of show you what road they want to go down. Now, as you get to know them a little bit and ask them questions about what's important to them, you as the product expert will know, like, okay, this might be a better fit for you. but they're going to guide you on which way they want to go. Okay. So again, this benefit chart is good for all insurance companies. Okay. And you can Google this information, and it's available to you. All right. And I believe that's my last slide. Next slide. And I will turn it back to Matt for any questions.
Awesome. Thanks, Carlos. So yeah, that concludes our presentation for today. We have about 10 minutes left, and for many of you, it feels like you're probably drinking through a fire hose right now. So use the chat. I don't know if we can open up the phone lines for questions.
No, we can't.
Would
We
love
can't
to
open
kind
it
of
up,
get some
but it's
feedback.
okay. Yeah.
Okay. Okay.
Yeah, they could send a chat or they could email, but right now we're just set up where they could just email or chat through the the system itself.
Okay. Okay. So yeah, if you want to use the chat for any questions, we can try to answer those right now.
They all got it, I guess.
Hey, this is easy.
They're ready. They're ready. We got one.
Oh, here we go.
Or we put them to sleep, one of the two.
Someone sent one. Someone sent on the question that says we need a summary slide of all these things because of this.
Oh, well, I'll tell you right now, I mean, there is a lot of information, and it varies on the Medicare Advantage side, county by county. So even us, the market managers for this area, there's dozens of plans with dozens of copays and premiums. We don't normally memorize all the information either. We just find out what county you want. All right, then we go look up and pull the plan information from there. So once you get certified, you'll be able to go in the system and say, all right, I have clients I'm going to meet this weekend in Alameda County. Let me call up the information there, and I go, oh, this plan's available, this plan's available. And then you can click on getting just the highlights. And so it'll be a line-by-line highlight of the plan in that area, premium, co-pays, the drug plan, that sort of thing. So it's easy to navigate, once you get certified and have access to our Jarvis, which is our website.
All right. I guess that's it. There's no other questions, but I do want to first thank Matthew, Brett, Kent, Carlos, all you guys for being on. Actually, Patrick is also joined us as well. If you guys didn't notice, Patrick Yancey's on as well. What's up, Patrick?
Hey, Jeff, thanks for having me on, guys. I got on a little late, but, as promised, you guys are in outstanding hands with Kent, Matt, Carlos, this whole team. They're outstanding, and the work that they do is well known, not just in California, but on a national level. You guys are working with a star team here.
Yeah, I can see that. So we're learning a lot, and we're excited. So thank all of you guys for being on. If there's any other questions, good news is that I did record it. So this will be up in the mobile app today. So you guys can rewatch it. I'll probably need to rewatch it myself. Wait, we got another question. Hold on. Let's see if we got that. Oh, no, we didn't. Did someone raise their hand? I think.
Hey, Jeff, one last thing I want to mention. For next steps, there's some self-study guides. So Medicare.gov is always a good resource to learn more about Medicare in itself. The UHC Medicare Solutions.com, that allows you to see the different plan details by zip code, as well as our AARP Medicare Plans.com. I'll send you an email with these links, and then we'll attach some enrollment guides as well, just so that you can start to familiarize yourself. Don't worry about the details, but just trying to expose you to a little bit more than just the surface level information. So we'll hit on all of this again, okay?
Sounds great. Thank you, guys. Thanks, everybody, for your time, and everybody that's the panelists. Thank all of you again. You guys did such an amazing job, and really appreciate all your hard work and your thoroughness of this information. So this is great. Excited for next week. Thank you guys so much. Thanks, everyone, for being on.
Thank you.
Hey, thank you, everybody. Hi, Patrick.
Thanks, everyone.